42-year-old woman presents with complaints of fatigue, weight loss, low-grade fever for a week. She noticed bleeding spots under her fingernails in the morning. Her medical history is significant for a recent dental procedure. She takes no medications. She is a non-smoker and does not drink alcohol. The vital signs are temperature of 100, blood pressure 138/90, respirations 21, and pulse 87. Cardiac auscultation reveals a pansystolic murmur in the mitral area with radiation to the axilla. Lab studies show a hemoglobin of 17.2, ESR of 25, WBC 12,000. Echo reveals valvular vegetations on the mitral valve with mild regurgitation. Blood samples are sent for bacterial culture. Empiric antibiotic therapy is initiated with ceftriaxone and vancomycin. So what is the most likely causative organism? It's the same thing with fatigue, weight loss, low-grade fever, and she takes no medications. Her vital signs are fine. Echo reveals a vegetation. Empiric therapy is initiated with ceftriaxone and vancomycin. So what is the most likely causative organism? So this is the only thing this is the main thing which is giving you your answer. Her medical history is significant for a recent dental procedure. So the second you know that, you have to think strep viridans. Okay, so dental procedures that involve manipulation of the gingival tissue or periapical regions of the teeth or perforation of the oral mucosa are considered risk factors for IE. Other risk factors are a prosthetic cardiac device, previous infective endocarditis, immunosuppression. In this patient, fatigue, weight loss, low-grade fever, recent dental procedure, all of this raises suspicion. Echo just confirms it. Okay, and viridin strep, these are the normal oral microflora. Clinical presentation includes the non-specific symptoms, specific cutaneous findings. We went over Osler's is painful. So an easy way to remember that Osler's is painful, just think of the O could stand for ouch. So that would help you remember painful. It's a silly thing, but it just helps you remember sometimes. And when infective endocarditis is suspected, it's important to order a blood culture in order to guide antibiotic therapy. So straightforward question, you don't need to get into the nitty-gritties. All you need to know is that table I showed you and you should be good.
Thanks for watching. Please give a thumbs up and subscribe for more.